Hi, my name is Dr. Stephen Hall, and I'm a lecturer in pharmacology at Lancaster University. So my job as a lecturer here is to, one, teach pharmacology to both medical students and biomedical and life sciences students, but also to do research on snakebite and venoming, which is truly my passion and what I'm really excited about. So my work on snakebite is to develop and discover new drugs that can be used for the treatment of this snakebite, specifically against the necrotic effects of snakebite. So snakebite can cause a number of different pathologies. The one that I'm most interested in is tissue necrosis. This is the literal destruction of the skin, the muscle, even the bone if the venom gets deep enough into the victim's tissue. And as you can imagine, this causes a lot of damage, it causes a lot of injury, and in some cases it can certainly cause death as well. And unfortunately, current treatments for snakebite, which is antivenom, is not very good at treating the necrotic side of snakebite. So by developing new drugs that can be used to treat snakebite, the hope, at least, is that these treatments can be used as quickly as possible in the field. So if someone gets bitten by a snake, they've got a treatment available right away rather than having to get to hospital, which can sometimes take hours before they get antivenom. And hopefully that these treatments would then help to reduce the necrosis caused by the snakebite envenoming. So a day in my life of doing this type of research really relies a lot on cell culture work. So I do a lot of work with cells, largely human skin cells in the lab, where pretty much you treat the cells with the venoms and you determine how much venom is required to kill the cells, and more importantly, which drugs and how much of those drugs is required to save those cells from the cytotoxic effects of the venom. Once we get that data and we determine which drugs and potentially which drug combinations are quite effective in the cell experiments, we can then move on to more robust experiments to determine the effects of those drugs and determine if they're actually effective in real life or perhaps not, which is still equally important to determine before you move a drug forward. And the hope is that with this data, it'll help to then eventually create a new treatment that could be applied to a patient in the field as soon as a snakebite has occurred to hopefully save their limbs as well as their lives from the cytotoxic effects of those snake venoms. So in my life, probably one of the most unexpected things that has happened is literally just living in the United Kingdom. I'm from the east coast of Canada, from a small little island called Cape Breton. It's really not very big, there's not a lot of people there, certainly no venomous snakes there. We have garter snakes and that's literally it. Even they are pretty rare, but for some reason, just as a kid, I've just always liked snakes. So the fact that I've somehow ended up in the United Kingdom doing snakebite research after doing chemistry and pharmacology is certainly not what I would have expected. Not, if I could have speak to myself 5-6 years ago, I mean, at that point in time, I had no idea that this is where my life was going. So I now live in the UK. I've got a kid here, and I've got a life here. I've got friends here, and I love it. And I still, pinch myself to about the fact that I've actually come this far and I've reached this point in my life, because I never would have thought in a million years that this is where my career would take me. The path towards my career was a little convoluted and very academic, very school heavy. Pretty much I did a lot of school to get here. I did my undergraduate degree back in Canada in chemistry. And after doing some chemistry research, synthesizing some compounds, I realized that really my interest wasn't in making chemicals just for the sake of making them. I wasn't passionate about it. I wasn't excited about it. And so I decided I wanted to do something a little bit more applied. My supervisor at the time actually suggested pharmacology. I hadn't even heard of pharmacology at that point in time. I didn't know anything about it. But I'd realistically always been interested in how drugs work and the fact that Somebody can take a drug for a headache, a paracetamol. It's just a small molecule drug, it's just a chemical. And then you take a completely different chemical and it's treatment for cancer, or it's a treatment for multiple sclerosis. There are so many drugs out there that have completely different effects. And the chemistry of them can vary so slightly, and yet you're going to have completely different effects. And I've just always found that fascinating. To then get to my current role as a lecturer in pharmacology in Lancaster. So I did my PhD in pharmacology, again, back in Canada, at a place called Dalhousie University, where I actually did work on breast cancer. And I worked on a group of compounds for their potential breast cancer activity or anti-breast cancer activity. And after that, I realized that I really wanted to work on something that I personally was more passionate about, and something that I just personally thought was really cool. At the time, I loved my city. I didn't want to move. I was happy there. I had friends there. It was a city called Halifax in Nova Scotia. And so my first postdoc after my PhD was actually with a beauty company in Halifax. It was fine. The work was okay, but it wasn't exciting. Certainly wasn't my passion. And it felt like a job rather than, a career and a passion. And if you pursue science, especially academically, the passion is a big part of it to really help you keep going and keep you excited about it. That was when I really started looking into snakes and snake venoms and learned about snakebite. And one thing led to another. I eventually applied for a Royal Society Newton International Fellowship, which for any international students that might be watching this, and if you're thinking about pursuing science in the UK, I highly recommend looking into the Newton International Fellowship, because it was invaluable for me coming here and pursuing this research, and I truly don't think I would have gotten here without it. And I ended up working at the Centre for Snakebite Research and Interventions in Liverpool, at the Liverpool School of Tropical Medicine. I worked there for 3.5 years. I did some really exciting work. I got to see snakes as much as I wanted. There's about 200 snakes there. I believe it's about 40 species of snake, from green mambas and black mambas to spitting cobras and saw-scaled vipers. There's a plethora of snakes, and it's amazing, as well as some amazing people that I got the opportunity to work with. That postdoc is then what made me competitive for a lectureship now at Lancaster University, where I'm able to pursue both educating students on pharmacology, my PhD, what my PhD was in, so how drugs work and how drugs can be used, as well as on snakebite and snake venoms, and developing drugs for that snakebite. So it's really been a whirlwind of a few years, and like I said, I can't believe that this is actually where my life and my career has taken me, but I'm very happy it has, and I definitely consider myself very lucky that I've managed to make it to this point, and I'm very pleased with how everything has worked out. So one bit of advice I would like to give to my past self, which I realize is much easier said than done, is to try to worry a little bit less. Try to be a little bit less anxious about where life is going to take you, about how things are going, and about where you're going to be in 1, 2, or 5 years. I realize that is so much easier said than done, especially in today's day and age, where university is difficult, schooling is difficult, finding a job can be scary and intimidating. But realistically, if you truly do, you work hard, you make good friends, you do your best to do great work while also not doing too much work. You have to make sure you don't burn yourself out. That's a very important thing to keep in mind, because if you burn out before you finish, then ultimately you're not going to help anyone. But if you're able to keep that passion alive in your field and continue to just do good work, then ultimately it really can help you out in the long run. So if you can try to just worry a little bit less, enjoy the ride while it's happening, and just live your life as best you can while you're doing your degree, your job, what have you, then I sincerely believe that you will reach a point where you are quite happy with whatever role you choose. Keeping in mind that there's not going to be just one role for you in your future career path. Your career could take you in 10 different directions, and it's all about choosing, one or two of them in which to pursue and doing your best to be happy while you're doing that career path.